231 231 testing 1 2 3. So just gave you last week's or next week's lottery numbers there, guys, on Facebook. Yeah, I messed up by saying last week's. Yeah, next. Is the sound working now? Don't worry, Lorena, there's no one on Facebook anyway. What is you? But oh, it's working now, is it? Okay, there you go. Well, well, just for that, I'm going to blur the virtual background. Oh, I shouldn't do that. Oh God. Oh, we have to pay. Choose a plan. Okay, I have to pay for another plan if I want a virtual background. Okay, moving on. Bobby can hear it. Yeah, Bobby, you're on Instagram. Facebook was not working. I'll tell you why it wasn't working, Lorena, because of this top of the range microphone I got on a what's it called, boom, wasn't working. So I'm actually on the microphone on webcam, which is as good as any, to be honest. So that's a bit of scrap metal there. Anyway, glad it's working now. Thanks for pointing that out. Could have been potentially disastrous. Honestly, the Facebook community would have been up in arms. So anyway, crisis averted, and we can move on. Yeah, what I was saying is I think rhinoplasty is quite a specialist thing, really. And I think if you are having a rhinoplasty, it's really crackly. All right, love, give me a break, will you? It's really crackly. What am I sound engineer? What do you want me to do? Plug it? Oh, get the blanket off. What? Well, I don't know. What am I supposed to do? Oh, my neck. I've dropped Instagram now. It's crackly. Oh God. Here we go. What about this? No. What HD? Oh, I've got all these microphones to choose from. 2121 212. I can't help you. I don't know how to resolution. Should I change the resolution? Play test. Oh, there you go. Test sound. Oh, that's freezing without the blanket. I tell you. Oh, the blanket's been on the way. I don't know, Lorena. I don't know what to say. I mean, we've got sound. What more do you want? You want non-crackly sound, do you? Well, listen, if you want non-crackly sound, you come to the wrong place, my friend, okay? You want crackly sound, I can do that for you. Non-crackly, it ain't here, okay? You have to go to an influencer who's got a proper microphone and the audio abilities, all right? So, quite frankly, this is the Aldi of live broadcasts, okay? You want Waitrose? Go elsewhere. Maybe I'll get another microphone one day, but not today. So this is all we got. I'm just gonna crack on, as it were, and I'm going to assume that it's acceptable. And if it's not acceptable, I apologise profusely, and I'll try and do something by next week. I'll get my audio team to look at it. But anyway, we're just going to crack on, because others are going to be all night, quite frankly. So, do we offer rhinoplasty is a question on the table, and the answer to that question is quite simply no, because I don't do faces at all. I don't do any faces in terms of facelifts and what have you. But what I was saying is rhinoplasty is something that a very long time ago I decided I'm not going to do. It's difficult, basically, and it's something that really you want someone who does a lot of. And plastic surgeons will often do a breadth of work, so you'll often find plastic surgeons who will do faces and tummies and eyes and breasts, and they might be doing hands in the NHS or burns in the NHS, and they'll be doing a breadth of work, but it is becoming more specialized. I'm for 15 years, probably, yeah, at least 15 years, I think, as a consultant, have basically done breast. No one really specializes just in body, so breast and body sort of goes together. So that's been my focus for the last 15 years. And as I say, so a long time ago, sort of before then, I decided I wasn't going to do rhinoplasties. And I think if you are going to have a rhinoplasty, you need someone really who specializes it. Really, I think it's a very difficult. Well, it's not so much. I've always said there's no such thing as a difficult operation. To be honest with you, there's only an operation you don't know how to do. And you know, but the thing about rhinoplasty is A, it's very visible, it's right there, and B, it's very subtle changes can have dramatic differences. And it's one of those ones where if you do too much, a bit like liposuction, you do too much, you've gone too far, it's sort of hard to come back from. So it's a vocation, I think, rhinoplasties, and I think people who do it sort of love it because it's quite nice. It's quite obviously very superficial surgery, very immediate results, quite satisfying how you can change the shape of the nose and what you can do to the nose, but it's not something that I have got into, and so if you want a rhinoplasty, ain't your man. Now there's a one with a oh, hello, we've got a question. Do you have a BMI limit to have a tummy tuck? Thank you very much for the question. Very, very nice. Well, guide, I'd say, rather than a limit. We've got a guide BMI for tummy tuck. So some places will say you've got to be this BMI and they won't even see you. You know, 30 is the normal. Some people are 27. They're like, don't even come into my door unless you've got a BMI 27 or 30 or whatever. And the reason for that is because you're going to get a better result if your BMI is below 30. I don't think that is in doubt. That's, you know, there is evidence. There are studies which said you're going to have less risk of complications, and also you're going to get a better result because globally, if you're carrying extra weight, you're still going to be globally carrying extra weight. When you have a tummy tuck, it just really addresses the tummy, and so it doesn't address you globally. So as a rule, if you can get your BMI down, if you can get your weight down, then that is a good thing, no question at all. So that's factual. To be honest with you, that's factual, whatever your BMI is, even if your BMI is above 30. So you can have a BMI above 30, and it would still be, if you want to lose weight, then you're better off doing that before surgery. So that's a given. You're better off losing weight before surgery if you want to lose weight. So that's the main thing. So that's why it's a guide, because some people are quite happy, have BMIs over 30 and are quite happy, particularly people who've lost a lot of weight. You have these BMIs, people who used to be a BMI of 45 and they got it down to 32. You know, it's a massive BMI drop. They've lost a huge amount of weight. So I find it's a little bit harsh to say, oh, 32 is a bit too high, I'm not going to see you. So I will have a discussion with people who have got BMIs above 30. Now, if you're asking the question, I will no doubts, you know, no question say that it will be better to get your BMI down, no question at all. But if you are happy, if you stalled, some people are never going to get a BMI below 30. I will have a talk. I will talk to you. We can rap about it. We can talk about the pros and cons. I'll be quite clear that you'll have a better result with less risk of complications with a lower BMI. But I have done tummy tucks on people with BMIs above 30. Let me put it like that, because some people, you're basically saying you're never gonna get a tummy tuck. Basically, if you're strict about your BMI, and I think some surgeons justify that, and I think they can justify that. To be honest with you, I think there is something to be said for it, because. But I just feel it's a bit sort of harsh on those people, other people. So yeah, so I would say a guide of 30 is where we are, but it's not a strict criteria. It's a guide. So how long is needed following breast reduction surgery? When can I return to work? So, I mean, the big thing, I guess, is what you do. Well, the two things is, one, it depends, because it depends on how it heals. With any surgery, I can give you guidance on that. But the main thing is what you do, you know, and I guess it's whether you're a sedentary job or whether you're an active job, whether that means active with lots of driving or potentially lots of moving and lifting, you know, and things like that. So let's just assume a sedentary job. So if you're in a sedentary job in terms of an office-based job, the first 2 weeks is pretty much out. Give yourself a break, give yourself some time off. So 2 weeks gone. Third week you'll be feeling better. I normally say 3 weeks for driving. Sometimes people are okay at 2 weeks. You've got to check with your car insurance company. They might say it's got to be a certain amount of time. So some people are okay at 2 weeks, but it's hard to guarantee that. And there is a big difference for people who work for themselves versus people who are employed basically. So if you work for yourself and you can pop into work and do a bit of dabbling and then go home early if you feel ill, you'll probably be starting to go back to work after a couple of weeks, because you know you can monitor your time. If you're employed and you have to work 9 to 5 sort of thing, and they're not very flexible with that, you're probably better off waiting till you're better. Because if you go in too soon, then they're going to say, why did she come back so soon? She's not ready. Look, she's just, you know, not pulling her weight and all that sort of stuff. So if you're employed, I would say 3 weeks is probably where you're looking at for going back to work. But if you're self-employed, you'll probably be dabbling and getting back into stuff after 2 weeks. If you can work from home, again, after a couple of weeks, you'll probably be able to do stuff from home. But in terms of driving and what have you, 3 weeks. If you are doing a manual job, if you're lifting people, if you're working in a care home, or if you're working in a warehouse or something, or for, you know, potentially lifting boxes and what have you, then that's at least a month, probably 6 weeks before you'll be doing any lifting. So whether you'll be able to do any sort of non-manual stuff before then, that might be possible, but that might yeah, if you do, but it's 4 to 6 weeks if you are doing manual things, manual activities. And then it's just starting to settle really then. So you're still going to feel a bit uncomfortable even at 4 to 6 weeks. You're not going to be 100%. You're going to be still wanting to take it a little bit easy and just easing into it. So that's a general guide that I give to people, and it is variable amongst people. Sometimes you have a little bit of delayed healing, sometimes you have a little bit more pain. So, you know, it's very much a guide. So you might find it all still uncomfortable at 4 weeks, don't really want to do much, and like, okay, well then that's then you better take it easy for a bit longer. So it is hard to be too specific for everybody, but that's a general guide in terms of work. So 2 weeks if you're self-employed, 3 weeks if you're employed. And we can give you a seat note and things like that if that's helpful to you. So when can you completely remove a keloid scar? Sorry, can you remove a keloid scar completely? Ooh, well, that's a funny way of asking a question. I normally don't remove them completely. Can you? Yeah, well, I guess you can. And certainly when patients come with keloid scars are sort of red, raised, lumpy scars. It's an abnormal form of scarring that some people have, and some parts of the body are prone to it, and some skin types are prone to it. And they're quite difficult to treat. And when you come with a keloid scar, if you've got a big lumpy scar on your hand or wherever it is, you might think, why don't you just cut it up and stitch it up and then remove it completely? That sounds like quite a simple thing to do, but we tend not to do that. And the reason we tend not to do that is because the reason you have a keloid scar is because of the way your body heals, the way your body scars. It's an abnormal process within your body, so it's not usually anything to do with the actual surgery that you've had. As I say, I might not have said this, but sometimes if you have delayed healing, it can predispose to more hypertrophic rather than keloid scarring, but raised lumpy scarring. But pure keloid scarring is actually a way that your body heals. And so if we were to cut out a keloid scar and stitch it up, there's a very good chance that scar will get keloid. And the thing about a keloid, one of the big things that differentiates a keloid from a hypertrophic scar is a keloid scar is a scar that extends out with the boundaries of the original scar. So basically you can have a tiny little pinprick like a earlobe pierced or some other, or a injection in your arm, and from that pinprick comes a big large scar. If we then cut out that scar and give you a scar that big, so if you had a pinprick and it's made a keloid that big and we give you a scar that big, then it's going to give you an even bigger keloid. So that's a very risky thing to do and something we're very worried about. So we therefore tend not to just cut out the scar and stitch it up. If the scar is smaller and manageable, you'll try other means like steroid injections, pressure dressings, pressure clips, and silicone gel or sheets. But if the scar's so big that you are going to need to have surgery, the surgery that we tend to do is what's called intralesional excision, which means that you actually don't cut any normal skin. All of your cuts are in keloid. So you kind of take a slice of cake, you take a wedge out, you kind of debulk the keloid. So you take the big lump off and you're stitching within keloid scar. So you're leaving a rim of keloid scar behind. So can you remove a keloid scar completely? You probably can, but the worry is it's going to come back bigger. So we tend not to remove keloid scars completely. We tend to do intralesional excisions, which relieves a rim of keloid scar behind, and your stitching or your stitches are in keloid, and that's less likely to come back keloid. It's a risk. So we will warn you there's a risk you could get a worse keloid. So we try and avoid doing surgery on people with keloid scars at all. Try and avoid it if you can. But if you can't avoid it, an intralesional excision is the way to go. And that leaves you with a rim of keloid left behind, which we will then treat with steroids or silicone or pressure or whatever the other modalities once it's into a smaller, more manageable size. So that's not a discussion we need to have with you if you are coming for a keloid removal, because it often requires a course of steroid injections after the initial excision. So what is the difference between a felt lipectomy and a Fleur de Lis tummy tuck? So yeah, so basically they're both larger types of tummy tuck, usually for people who've had significant weight loss with a significant amount of excess skin. Standard tummy tuck just gives you a scar in the lower abdomen. So these are both give you extended scarring, and extended scarring equals increased risk of complications, increased cosmetic effect because of the more scarring, but more skin removed. That's how it works with plastic surgery. The more skin that we remove, the more scarring we give you. So a lot of people want kind of less scarring. It's like less scarring means less skin removal, means less of a result. So these are reserved for massive weight loss patients. And a Fleur de Lis tummy tuck is the same as a normal tummy tuck, where you've taken a ellipse of skin from the lower abdomen, from the belly button down to the pubic area. You take all of that skin and you bring it down. So you sort of take out the skin in an up-down direction, which is where most of the laxity is in a patient who needs a tummy tuck. Now, if you've got an awful lot of spare skin, a Fleur de Lis tummy tuck will combine that up-down removal with a side-to-side removal of skin. So that involves, so instead of just having an elliptical shape, you're having if you can imagine an elliptical shape this way, an elliptical shape that way, where those two ellipsoids, so if you can imagine, so that's a tummy, yeah, tummy, belly button, yeah. So normal full tummy tuck is an ellipse in the lower abdomen from the belly button. So that's the head. Is it obvious the head's up here? Yeah, head's up there. Maybe that's obvious, I don't know. Anyway, head's up there. Head's up there. There. So that's a normal tummy tuck. Gives you a scar in the lower abdomen. Oh God, this is hard. Gives you a scar in the lower abdomen there. So if you can imagine taking it in an up-down direction as well as a side-to-side direction. So I'm going to kind of, I don't know if this is a helpful way to, but if you can kind of imagine a side to side, so the same skin side to side as we've done up down, that takes it an up down and a side to side direction. So that what that gives you is that sort of excision. So if you can imagine it, so it ends up really looking like that. So that's sort of like taking it up down and side to side, which gives you so your normal tummy tuck scar is kind of down there somewhere. There, in the bikini line, but your Fleur de Lis, we've got in the middle of it, It's the same as a normal one, but it's got a straight line up. Is that clear? So that point and that point come down to that point to form that T junction there. So that's the tightest point there, that T junction there. Oh, I've got to go up here. Yeah. Oh God, the light's all over the place, isn't it? Can you see it on Instagram? I don't know if you can see that. What makes you decide if I breast up? Oh, good, good. Yeah, yeah. You see that? So anyway, so that's a belt. That's a oh God, that's a Fleur de Lis. So that's a Fleur de Lis. So it's an up, down, side to side. So that's just kind of an extended form of a tummy tuck. And then a belt lipectomy or a circumferential tummy tuck goes all the way around. So it's the same as a normal tummy tuck, but it carries on going all the way around. So it goes around the back as well. So it's really for, especially for the side, laxity at the side skin. It really takes down that laxity at the side skin, but it gives a circumferential scar, which basically meets itself and is both of them have got increased risk of complications because the Fleur de Lis has got that T junction and the circumferential has got tension on the back as well as the front, and the risk of turning you during theatre, which increases your risks. So they are basically both extended forms of tummy tuck, and therefore people who've lost a significant amount of weight, and you have to take on the potential for increased complications if you're going to have one of those types of tummy tuck. But they do take out more skin and give you a better result in the right patients. Not everyone's a candidate for it, to be honest with you. You have to have a significant amount of excess skin to justify the increase of risk and scarring and what have you. What you got, V and her VSG. Hi JJ, what makes you decide if a breast uplift needs implants or not, please? Simple, V and her VSG. In my life, it's simple. In patients' lives, it's not simple, but in my life, it's simple. And one question can answer that. And I say to you, what cup size are you? And you say, I'm a B or a D or a C or whatever it is. You say, I'm at this cup size. I'm like, are you happy with that cup size? And if you're happy with the cup size, if you're happy with the volume that you've got in a bra, it's a lift, no implants. If you say, I'm a B cup and I want to be a D cup, or I'm a C cup and I want to be an E cup or whatever, if you want to be a bigger cup size, it's implants. For me, implants are really good at making the breast bigger. That's what implants do. If you don't want to be bigger, don't have implants. So that's why it's simple in my life, because that's a simple answer there. However, I then go on to show you photographs of the sort of shape you can achieve with a lift, because some people think they're going to be quite full up there, which they are when you first have it done, but that settles. And so you have to be prepared for the kind of shape you're going to get with a lift. And some people say, hold on a minute, I'm not happy with that. I want them to be fuller. I'm like, well, if you want them to be fuller, well, that's implants. So they, yeah, I want them fuller, but then they're going to have to be bigger. And you have to accept that. And some people say, oh, okay, I'll accept that because I like the shape. So there is a discussion sometimes if you'll say, hold on a minute, I don't like that shape. And then that's when you get into implants. For me, I'm not sure if it's worth taking on implants just for the shape. I'm like, well, why don't you just see how you go, and you might be happy, and then you could always have implants as a later date, because the lift and implants combined is a big operation with a high risk of complications. So there's a lot to be said for staging it. So if it is shape is the predominant problem, then it might be worth having just a lift. And similarly, if size is a problem and shape's less of a problem, it might be worth having implants and seeing what they look like, and then you could always have a lift as a second stage. Now, if it is shape and size, then a lift and implants is the way to go. But yeah, it's really, if you want to be bigger, I think implants are good, because they do have a risk of complications and potential for problems in the long term. So if you can avoid implants, I would say you should, but you have to be comfortable excuse me, with the sort of shape that you can achieve with a lift without implants, because if you're using your natural tissue, it always settles. And so that's a discussion to be had pre-op, not post-op. I often see people, not often, it's not fair, I sometimes will see people who say, I've had a lift but this other place and it's rubbish and I need it done again. And I have a look at it and I'm like, that's why, what can I do? I can't do it again. What do you mean do it again? It's fine. And they're like, look, it's like droopy again. I'm like, no, it's not droopy. That's natural breast shape, and oh god, cancel, and it's a lack of communication pre-op, because that's actually often an acceptable result for a breast lift, because the shape does tend to settle. What I would say is a natural breast shape, but you have to be comfortable with that, and it's always a significant improvement on the pre-op state. Sometimes people have in their minds the sort of shape that implants can achieve, and so that's the problem. If you have that in your mind and you have a lift without implants and it's not up here, it's like it's not going to be up there. So you can put a bra on, it's up there, but when you take your bra off, it'll settle. If you've got natural breast tissue in there, it settles. If you want that fullness up there, that's implants. So that's where the discussion has to come in. If you want that kind of shape, as I say, if you don't want the size, I would say think about compromising on the shape. But yeah, that's how I decide. But obviously it's a discussion with the patient, because they've got to be happy at the end of the day. It's no good me saying, oh, I'm happy with that, it's a great result, and they're like, oh, it's terrible. Very patient dependent, the results of this kind of game. It's all up to the patient really, whether it's a good result or not. But thanks for that. Why? Hold on a minute. We've got another question. Hold on. My non-surgical brain arm lift and breast reduction lift at the same time. Can lift your arms after breast surgery. Minimal arm movement after arm lift. Do you do both surgeries together? Yes, quite a common one to do together. V and her VSG arm lift and breast reduction / lift is quite common. I think it's fine to have two things done together, and often it's quite good to have them kind of close together, because then that sort of releases your lower body sort of thing. To have a sort of arm lift and a thigh lift is a bit like, oh god. Plus, in terms of draping and prepping and theatre, it's quite good to have them together. So perfectly reasonable to do them together. And yes, you can lift your arms after breast surgery, and you can lift your arms after arm lift. To be honest with you, in her VSG, I have dressings on, but you can lift your arms, you can move, you can comb your hair, brush your teeth. You can do stuff after breast lifts and arm lifts. And yes, that's I would say, is it a common complication? It's when you do combined procedure, so that's a normal. I wouldn't say it's common. The breast and the tummy is probably more common, but it's not uncommon. How's that? It's not uncommon to do a breast lift and an arm lift. That's what I'm looking for. It's not uncommon that in her VSG to do a breast and arm lift. Not uncommon at all. Why is the upper arm, chest and back not a good place for scar? And this is because we get a lot of photos of people with their tattoos, and they say, I want my tattoo removed. And if it's in one of these places, I often say, well, it's not a good place for a scar, because a lot of people say plastic surgeons are brilliant because they don't leave scars. Now, the fact of the matter is, a lot of the stuff we do is on the face, and the face leaves good scars. So this face scars well as a rule. Other parts of the body don't scar so well. Shoulder, chest, I really would avoid having surgery there at all if I could. Keloid, hypertrophic scarring, risk of ugly lumpy scarring. So you've got to be very careful. You've got to be wondering what the thing is that you're doing the surgery for in order to justify putting a scar there, because there's a very high risk of a poor aesthetic outcome from that scar, and that whatever it is that you've got could be better than having the scar there. So yeah, shoulder and sternum are like really high risk areas. Back always tends to stretch, always stays a bit red. Doesn't, you hope that it fades in a few months, but the back can stay a bit red. Stretch scar rather than your hairline sort of stretches like that. Not great. Upper arm, yeah, again less so, but skin's tight, obvious scarring, stretch scarring. So these areas, the dermis is much thicker, the skin's much thicker. There's much more of a risk of an unsatisfactory scar, and they can be a bit more obvious basically on the trunk and the limbs. Really, the scarring can be a little bit more obvious than if you see someone who's had something done to their face, for instance, because the face scars does tend to scar very well. So it's something to take into account, particularly having something like a tattoo removed. If you don't like the look of the tattoo, we've got to be a little bit careful. We don't give you a scar that you then don't like the look of either. So it's you don't really want to trade one thing you don't like for another thing that you don't like. Is it normal to experience pain in the central abdominal area and around the belly button after having recti divarication? So recti divarication is the muscle repair for which you do pretty routinely for a tummy tuck, and the recti are the rectus abdominis muscles. There's two of them. They're the six-pack muscles. They go side to side, either side of the belly button, and they're often a little bit apart, and so you will often bring them together. So the fact they're a little bit apart is what we call the divarication or diastasis of the recti. And so it's bringing those muscles together. And so yeah, is the answer to this. It can be uncomfortable bringing them together, and sometimes it can be uncomfortable up sort of towards your rib cage. And if you had a tummy tuck, obviously the incision's in the lower abdomen, so you might think, why is it uncomfortable all the way up here? And so that's why, because those muscles are brought together. Every time you move, you cough, you sort of tensing that abdominis muscle, and it's putting on the stitches and going to be uncomfortable. So yeah, it's quite normal to have pain in that area and around the belly button after having a recti divarication repair. So that's very normal and nothing to worry about, and it usually settles pretty well, but it can be quite uncomfortable depending on how wide the divarication is. Obviously, the wider it is, the more tension there is, the more uncomfortable it is. But yeah, that's a normal part of the healing process of a tummy tuck. What you got, Ian? I have a 10-inch scar from botched gallbladder removal surgery. Can you make this neater when doing an FDL? How do you make a neater scar? I heal well. So yes, so one thing I would say is often, as I say, abdomen and places like that don't tend to scar quite so well as other parts of the body. So if you have a scar that you don't like, what we would really be saying is, what don't you like? And you might think, what are you on about? It's a scar, get rid of it. I'm like, no one can get rid of the scar. So you're never going to have a scar being removed. If we do surgery, we're only going to give you another scar, and we've got to hope our scar is better than the old scar. So how do you make a neater scar? Well, one thing is, when you're doing gallbladder surgery or whatever, orthopedic surgery, whatever, your focus is often on other things. You focus on getting the gallbladder out, doing the hernia repair, doing the hip replacement, whatever. So they're not as focused on the scar as perhaps we would be. But also, as I say, scars on that area often do stretch a bit, do look a bit red, do not look great. So sometimes you might say to you, look, that's normal for the scar in that area. So it might be that we're not able to make a neater scar. If there's a particular problem with the scar, as I say, if it's stretched quite a lot, if there's particularly problems with the healing, if it's dented in, or if it's raised up, those are the sort of things we might be able to do something to maybe fix that, to try, and if it's dented in, bring some tissue underneath. If it's bumped up, maybe use some steroid to dampen it down and make it a bit less bumped up. If it's stretched, bring it together and maybe put some deeper stitches in to try and hold it together to stop it from stretching again. No guarantee. It might all go back to how it did before, but if there's something specific about it, there might be things we can do to give you a different scar, which hopefully will be preferable to your current scar. But that is always the worry about doing a scar revision, that we just give you another scar that actually ends up looking similar. And to be fair, that can happen. And obviously it's a bit distressing, because people think, oh, he's a plastic surgeon, he's going to do a great job, and then you do your scar revision and it looks similar to the original one. It's like, so now we have to sort of be realistic with you and say, look, you know what, it might look similar, that's not actually a bad scar. That's often what scars look like on the abdomen. So yeah, don't want to be too negative. Realistic, that's what we're trying to be. And sorry, I've had muscle repair because of the 10-inch scar from belly button to breastbone. Belly button to breastbone, got it. Would you do a muscle repair again if it wasn't a good repair before? Emergency surgery before? No. So muscle, okay. So I don't know what muscle repair you've had. So as I say, what we tend to do, we do call it muscle repair. We do use those words, muscle repair, but really it's not really muscle repair. It's bringing those muscles closer together. So it's bringing the rectus muscles to closer together if they're wide. So I guess if your muscles are wide, then yes, we would bring them together. But I don't know. You're saying it's not a very good repair. I don't know. So does that mean you've got divarication again, you've got a bulge above your belly button. So if you've got a bulge, then yeah, you could do it again for sure. But if it's not, if the muscles aren't apart, because what happens is you bring them together with stitches and then it scars together, and it kind of stays together. So and if you've had a lot of surgery before, there might be quite a lot of scar there. So it actually might be quite hard to bring it together. It's quite unforgiving if there's a lot of scar there. So basically assess it and see if there's still a divarication there, but we wouldn't do a muscle repair again just because you're having surgery done again in the area. We'd have a look and see if you need the muscles to be brought back together again. We're not really repairing them, we're just kind of bringing them closer together, although we do use the term repair. Perhaps we shouldn't. Having lost 10 stone, the scar, well, the scar cuts my fat in half. Yeah, I don't care for this guy. Yeah, that's so. It's that's often the problem with the up. It's an up down scar. I'm saying, thinking. So yeah, it can sort of do that. Be dented in and cause a. Oh, were you saying something about FDL earlier? When doing an FDL. So yeah, so if you've already got a midline scar and you've got laxity in a side to side direction, that might be a reason to have a fleur-de-lis. Particularly if you have got a bad scar and it's dented in, because it's going to be hard to pull it down with a normal tummy tuck. So that might be actually quite a good indication for a fleur-de-lis if you've got a dented in up and down scar. So it would, because if you try and pull it down, it's got no give in it, it doesn't really move. So and losing 10 stone is fantastic. Well done, that's amazing. And you would, well, just on that alone, be in the realms of the sort of person who would have a bigger op than a standard tummy tuck. So a fleur-de-lis would be an option. And yes, if you have a midline scar that you don't like, a fleur-de-lis would get rid of it and give you a new midline scar. And we would just have to try and make sure we stitch it up so we get some fat underneath the scar so it doesn't dent in again. So that's what we do to try and make them neat, to try and make them not dent in and not look good. So a lot of the time when you're training to be a plastic surgeon is about tissue handling, making sure you don't traumatize the tissues too much, and trying to make the scar nice and neat and evert the wound edges to try and give you the best possible chance to get a good scar. But even with all that said, scars on the abdomen, particularly the up down scar, can be a little bit obvious. So but I think you on paper you would be a good candidate for a fleur-de-lis to get rid of that dented in up and down scar, and albeit giving you a new one, but hopefully not dented in, and have a look at the muscles to see if they need repairing. But as I say, they wouldn't necessarily definitely need it. We'd have a look at it and probably examine you in clinic to see if you've got a distance between your rectus muscles. You can examine yourself, lift your head and shoulders up off the bed and hold there, or do a straight leg raise, both legs, and just hold there between your belly button. You have a look, see if you get a bulge come up. That would be a way to find out. Well done on the weight loss, and yeah, plus. Well, I'm out. I'm declaring myself out. So sorry about to my Facebook fans, both of you. Sorry about the problems at the beginning. And hoping the technical team have managed to sort out the crackly nature of the microphone. Instagram is never a problem because it's still on the phone, so that's always worked. Apart from it falls off because my tripod's broken, but apart from that, so I will be back next week, I'm pretty sure. Thank you, V and her VSG. Can I just call you V? Don't know if I call you V. You're very welcome, V. I'll be back next week, I think. It's half-term week after next, I discovered, not next week, half-term week after next. So probably won't be on then. So save that up for next week. Got any questions, call me, and I will see you 7 o'clock. I hope you have a lovely evening, and yeah, keep up the good work.